what are the most common misconceptions regarding physical health and injury prevention?
The biggest one that comes to my mind is like the no pain, no gain. People always want to like push through a lot of pain in order to gain this sort of like muscle or something like that. But sometimes that could be bad because that could actually lead to injuries.
Like if I have neck pain,
Yeah.
who is the best person to go to? Like how would I come to a decision of that? What are some of everyday practices somebody can incorporate in their life to prevent injuries?
Don't forget your hydration. You cannot forget your sleep. Like Roger Federer, LeBron James, the biggest athletes in the world, they're sleeping like 10 to 12 hours a day. Your sleep is key. Don't forget the basics, and when you're doing your working out and your exercises and things of that nature, don't forget the low level exercises like the zone 2 cardios and things of that nature, like getting in the swimming pool and just swimming at a very low pace for 45 minutes. Excellent exercise. You're actually getting stronger as an athlete, but it's not wearing your body down as much because
I've seen people who would get injured and then they would quit the sports they would love. Like, what should be the mindset of overcoming this fear?
My recommendation is always to not give up on the thing and address that fear.
Right.
Like there's a certain point where you're gonna be like, okay, well, yeah, I can't sprint when I'm like 80 years old.
And kids these days are, at least that's how I see it, that they don't go out much, they don't play outside much. What kind of physical activities or habits do you think that they can incorporate? Hello everyone and Assalamu alaikum to another podcast. I have somebody here today who has studied in physiotherapy and has been practicing physiotherapy as a career for the past 3 years. So before we waste any more time, let's introduce Mr. Waleed here. Waleed, thank you for taking out time for us today and joining us here.
I'm very grateful to be here. Thank you.
So Waleed, the first question I have is why did you choose physiotherapy as a career, and how has this shaped your perspective about health and wellness?
Okay, so I chose physiotherapy as a career mostly because it combined my passion for how active I was in not only high school but also university.
Right.
But it also allowed me to pursue my passion for my sciences. Like I really like to study that, but I couldn't really find a career that fit my level of activity with what I wanted to study. So I chose physiotherapy because it allowed me to still learn about the sciences but also keep promoting movement. In terms of how it shaped my perspectives on health and wellness, I always believed I was always very active as a young kid through high school and everything. But what I find really interesting about physiotherapy is that it allows me to work with people from all walks of life. It could be a kid, like a child that has like cerebral palsy, or like my dad who has like knee issues, right? So it allows me to work with so many different people. So what it shows me is the challenges they face, so then I can learn from them in terms of how I could prepare for the challenges that they face. So it's like a give and take for both of us. So lots to learn in the field to educate the patients, but the patients also teach me a lot of stuff in terms of the struggles and everything that they face.
Right. Now, what are the most common misconceptions the young people have regarding physical health and injury prevention?
Biggest one that comes to my mind is like the no pain, no gain. Like people always want to like push through a lot of pain in order to gain this sort of like muscle or something like that. But sometimes that could be bad because that could actually lead to injuries.
Right.
Another thing that comes to my mind as a misconception in terms of your physical health and injuries is how we sort of approach injuries. It's like, if I injure my ankle or something playing a sport, then I'm like, okay, I'm gonna rest it for like a week, 2 weeks, and then I'm gonna sit at home and ice it, and then 2 weeks later I'm gonna go play the same amount of sports that I played like 2 weeks ago, expecting that injury to be better. That's a misconception because you're not really doing any work in between, and you can pretty much injure yourself again. Other things that come to my mind as a misconception, one more thing, I think it's just like we're always looking for a quick fix, right? We're looking for our ability to recover from an injury like within maybe 2 to 3 days, maximum a week. If not, then there's something wrong with us and the world is like falling apart. right? So I think that's a big misconception too in terms of what physical well-being looks like.
Right. Now, Walid, I think if I'm not wrong,
Hmm.
RMD specialists and chiropractors and yourself as a physiotherapy, you guys are branches of I think the same science. I would say. If I'm
Yeah,
not wrong.
we call it the
But
rehab sciences.
what are the difference? Like, what are the main differences between a physio and a chiro and any other profession? And how does one choose? Like, if I have, I don't know, a neck pain,
Yeah.
who is the best person to go to? Like, how would I come to a decision of that?
I think that's a really good question. I think the main differences, we can start with that part first, is I feel like physiotherapy is all about me assessing clients' ability to move, right? Where their restrictions are, what kind of pain they feel with certain movements.
Right.
And our goal is then to form an alliance to try to help them move better. That is our focus. Whether that's through manual therapy, mostly it's through exercise. We get them to move and create confidence there. I think that's what sets apart physio. When you're thinking about an RMT, a registered massage therapist, you're thinking more along the lines of, okay, like this person is looking for a release in their muscles. They want to spend half an hour to an hour just getting a release with all the tightness that they experience because they're pretty sedentary. They're just sitting at their desk all day. So like that's a little different. And a chiro is essentially assessing your spine and trying to find a way to adjust your joints or anything like that to try to get a response from your body that's something that's positive. Now, how do you decide on who to go to?
Right.
I think you have to start somewhere. I think it's already a start that you're thinking like, okay, I have pain, I need to go see someone.
Right.
You can go with any professional, in my opinion, so long as if the pain or the goal that you have with the rehab science, you achieve it, that's all that matters.
Right.
But if you go to massage and it doesn't work out because you actually need to move and you're afraid to move because of the neck pain, or like if you play cricket, for example, right?
Right.
If you're like, I get neck pain when I'm playing cricket, the massage might not work perfectly, right? Because you need to move with confidence and make sure that there are certain movements that are, if they're causing your pain, then you need to like address that, and that's where I think physio can come in. A chiro adjustment could be more so for someone who is in a lot of pain at that moment, and they just need to get a release to make sure that they're able to move in that moment.
Right.
Okay.
Right. So Walid, my next question is like, what are some of everyday practices somebody can incorporate in their life to prevent injuries and have like to prevent long-term issues as well? Like, what are the some basic exercises you would recommend that everybody should incorporate just to have that better movement of joints and whatnot, right?
Yeah, I think I feel like you have to start with the basics, right? Like the basics is making sure you hydrate well, right? Like just drink your water, make a daily practice of walking, right? Like people underrate walking in an environment where everyone's working from home. We forget that we can just go outside and walk for like 20 to 45 minutes, and that will be really helpful for our joints and our muscles and all that.
Right.
Sleep is a big thing, right? So like making sure that we just address those three things is the first spot that I start at. Like I always ask my patients, like, how did you sleep? How are you sleeping with this pain? Are you having any issues there? Because if they're not sleeping well, then I would be like, okay, we need to address that first before we do anything, right? So daily practices that you can do, definitely start with the walking. If you're looking for specific exercises, my recommendation would be like, there's no one perfect exercise.
Right.
I think it'd be more effective if you kind of go and follow someone that is decent at mobility. Patients that I see, I recommend go see a guy named Tom Merrick on YouTube. He has like beginner mobility flows.
Right.
Easy to follow along. You can do it at home. It's on YouTube.
Right.
It's all for free. Try it out and see how it feels. The specific exercises, I don't give them out because it sort of depends on the patient.
Right.
If I give like 3 exercises,
But is there like a full body exercise which you would say that, hey, just when you wake up, just do this?
I think
this is gonna release the tension in your body.
There's not one perfect exercise.
Right.
I mean, if you were to look for one, it's there could be, it depends on the person, but like there is something called the world's greatest stretch, where essentially you go through a whole flow where you get to move the hips a bit, your mid back a little bit. I don't know, I can't show you right now on camera, but yeah, like you can search up the world's greatest stretch, do like a set of 10 of those and see how that feels. But my honest recommendation is like finding someone on YouTube of your own choice if you want, or you can follow someone named Tom Merrick on YouTube. He's really good. I usually give that to all my patients. It's very easy to follow along. Do what you can. His
now,
flows are
just because you brought YouTube up,
yes,
there like in this time, it's very easy when you pop up Instagram or you pop up Facebook or you pop up YouTube. There are so many videos, so many people suggesting so many different things, and we are of opinion that whatever somebody's saying it's gonna work, we just start following it blindly.
Yes.
As a physio, as a person who knows the knowledge behind how does the body work and the bones work, would you recommend that? Like, is that something that people should do? Like open Facebook and just start following somebody and don't even know if it's gonna work for them or not?
It depends on your goals. I think when you have a lot of options, sometimes you just get paralyzed by so many options. And I think I'm a victim of that too. Like there's so many different things that people promote. Should you follow it blindly? I wouldn't recommend that. I feel like you need to figure out what your goals are first. Like you need to identify if you're trying to like just put on some muscle and be somewhat active. I think it's fair to say that there's a lot of programs out there for you that are suitable. Right? It just depends on which one speaks to you. Right? But I wouldn't say like you have to follow it blindly. You need to do your research. Try something. Again, like I said, try something, and if there's certain aspects of that program that don't work, or you find that you're having pain or you're struggling with something in there, that's an opportunity for you to go see a physiotherapist, in my opinion, because now you're identifying movement disorder or movement dysfunction and you trying to actually move more. And then that's when you can go to a physio and be like, I'm struggling with a squat. When I squat with 100 pounds, my knees hurt. When I deadlift with like 100 pounds, my back hurts. What's up with that? Can I deadlift? What's wrong with me? That's when you go to a physio and they assess you and identify what your deficiencies are that might be contributing to your pain and preventing you from moving. So my answer to your question, try something, find out if it works for you or if it's too easy for you or if there's pain there. If it's too easy for you, try something else. If it's too difficult and you're having issues with it, go see a physiotherapist.
Now, Walid, I'm going to relate to what you said earlier. That we have a mindset of no pain, no gain concept, right? Like it's like, oh, if it's paining, I'm gaining, kind of thing. So how can somebody judge? As you said, you start following something, and how, probably somebody starting exercising for the first day, they're gonna have some pain. Like, when is that threshold that, hey, you know what, I've been doing this for 5-10 days and still pains me. Like, should I stop doing it? Should I go see a physio? Like when is that, hey, it's enough, too much pain, I need to stop doing this?
I think a simple rule of thumb when it comes to that kind of stuff with any exercises that I prescribe or anything that you're doing on your own is my pain increasing more than a 3 out of 10? Now 10 being like the worst pain that you've ever experienced in your life, 0 being like no pain at all. If it exceeds more than a 3 out of 10 for you, if you're like, man, that hurt, I would give it like a 3-4 out of 10, that's an opportunity for you to slow down. It does not mean that you stop. So I'll give you a very clear example. So let's say in your program you have to do 3 sets of 10 for body weight squats. Okay, you're doing your second set and you're like, I feel my right knee hurting a little bit. If it's a 1 to 2 out of 10, keep continuing with the sets. And that's my recommendation. Okay. But if you're on the third set and you do 5 reps there and you're like, wow, my knee pain is now up to 6 out of 10, I would recommend stop doing it then, take it easy for that day, follow it up the next day or a couple days later and see if you can do the 3 sets of 10 again and see if that same pain is recreated. If it is, then you modify it. You don't do 3 sets of 10, you do 2 sets of 10 until you find that threshold where you're not hurting past the 3 out of 10. Okay?
Right. Now, how can young athletes differentiate between pushing themselves or preventing them from injury or self-care? Like I see, like as you said, no pain, no gain concept. People would like to push more and more to, I don't know, achieve more out of it in a less period of time. Like
100%.
what would you suggest that, what's the difference between pushing yourself and actually realizing that, hey, self-care is important too and healing is important too?
You never forget about the self-care and the recovery
Mhm.
as you're pushing yourself as an athlete. Now, if you're an athlete and you're training like 5 hours a week,
Right.
right? That includes the sport that you're playing. It could be cricket, soccer, basketball, whatever. If you are spending 5 hours of those 5 hours that you're working out just playing your sport or lifting very heavy, that is not giving you any time to recover.
Right.
That could be a risk of you pushing it too hard.
Right.
I can take a similar athlete and be like, I want you to push yourself really hard for 3 to 4 hours a week, right? Play your sport, lift heavy, but I want you to spend 3-4 more hours doing very low level exercise. What does low level exercise mean? Get on a stationary bike and just bike for 45 minutes. Why is that good for you? Because it keeps you in a state which promotes recovery. Now, other things to keep in mind, when you were asking me a question earlier about what are some daily practices that I can apply right now, today, I would regurgitate the same point, right? Don't forget your hydration.
Mm-hmm.
Never forget, as an athlete, you cannot forget your sleep. Like Roger Federer, LeBron James, the biggest athletes in the world, they're sleeping like 10 to 12 hours a day. They don't give up their naps or anything. Your sleep is key. They prioritize their recovery so that when they're ready to push their body hard,
Mhm.
they know that they can recover again when they sleep and eat and drink their water well.
Right. So sleeping is important.
Very, very important. Like, don't forget the basics. And when you're doing your working out and your exercises and things of that nature, don't forget the low-level exercises like the zone 2 cardios and things of that nature. Like getting in the swimming pool and just swimming
Mhm.
at a very low pace for
Mhm.
45 minutes. Excellent exercise. You're actually getting stronger as an athlete, but it's not wearing your body down as much because you're in the water. So there's not as much pressure on your joints or your tissues that much.
Right.
Right? So you just need to not forget the recovery part of it. You can actually push yourself a lot and actually recover really well too. They go hand in hand.
Right. Now, Walid, what would your advice be to somebody who is going through an injury or a physical setback? That what kind of mindset they should have for recovery? Like, I've seen people who would get injured and then they would quit the sports they would love, or
Yeah.
they cannot just continue anymore. What would your advice be? Like, what should be the mindset of overcoming this fear?
I think the biggest success story for my patients is to do as much as they can. So sports, they give you what I believe are a lot of movement options, right? Like it puts you in different awkward positions. Like working out doesn't like necessarily do that, right? Like when you're playing cricket, you have to jump and catch while you're in the air. Your body's moving in so many different ways,
Right.
right? So my recommendation is always to not give up on the thing and address that fear.
Right.
Like there's a certain point where you're gonna be like, okay, well, yeah, I can't sprint when I'm like 80 years old, right? But even still, I would encourage you to move as much as your body allows you to. You need to push yourself as hard as you can,
Right.
right? Like your mindset shouldn't be that as soon as I hurt myself, I'm gonna rest and try it again, and then if it doesn't work out, I'm giving up on that thing and I'm just moving on to something else.
Right.
You're not addressing the fear, you're not addressing the actual issue that's at hand, and you're just kind of avoiding it, really.
Right.
Once you avoid that, you're decreasing the amount of movement options that you have as a human being. And that to me is really important when I'm dealing with my clients. I'm like, you need to increase that as much as you can, right? So the mindset should always be injuries are temporary. They're only there as a means to allow you to get stronger, to do more as you get older. You know what I mean?
Right.
So always have the mindset of trying to grow through your injuries rather than being scared of them.
Right. Now, Walid, and we live in times when we're very tech savvy, and kids
Yeah.
these days are, at least that's how I see it, that they don't go out much, they don't play outside much, and they have, these PlayStations and Xbox to sit at home and play with
Yes.
their friends. What do you recommend, like with the pressure of work and studies these days? What kind of physical activities or habits you think that they can incorporate while dealing with all these stresses and not being that mobile as people before us used to be?
I can tell you based on what I've done myself, right?
Right.
So like COVID was an amazing time to sort of learn about this stuff. It actually allowed me to reflect on a lot of things, right? So like when you say Xbox, PlayStation stuff, that's all I did. Like I sat down for like 4 to 6 hours at a time, and I would just sit there for like 4 to 6 hours at a time and just play video games. But what I learned though is that there are ways to actually still find a way to move while you're doing those things. What I did for myself was just to set a timer. Like every half an hour to an hour, I would like get up and just do like 10 squats and 10 push-ups. Every hour. Like those are, like there's very simple things that you can do. Like you can just make it a goal, like every hour.
I've heard of walking treadmill desk or something.
Yeah, that's a big one too. Like when I tell my patients when they come in and they do a work from home job, and I say, hey, like you should get up every hour. Like, oh my God, how am I gonna do that? I'm like, just put a timer on your phone when you are done 1 hour of work. When you are religiously just working, I don't believe that you're working. You're probably scrolling through your phone a little bit. But if you're working for a whole hour, I recommend you to get up and actually just walk around a little bit. Do some exercise. I like to do push-ups and squats. I just pick a number 10 and then I just do 10 and 10 of each. By the time you finish like a 7 to 8 hour day, at that point, if you do that for each hour, I want to be at like 70 squats for the day and about 70 push-ups.
Right.
There's not a lot of people out there that are just doing that.
Right.
But if you break it down into like, sometimes when exercises is on the table and I'm having discussion, most people are like, it needs to be like a full course meal. Like, oh, I need to do everything perfectly, like everything, throw everything in there. I need to do 100 squats, 100 bent over rows. Gotta do a lot. Sometimes they can just be like little snacks. I call them movement snacks. Just pick something and just do it every hour and just make that your challenge.
It's like something is better than nothing.
Exactly, like because if you're very sedentary and you just say every hour I'm gonna try to just do this, it could just be as simple as you just hop in the same spot, or you can skip rope for like 30 seconds if you have a skipping rope, or you can grab like a resistance band and just do banded pull aparts.
Right.
Every hour, if you make that a practice, you won't feel lazy throughout your day. And then if you supplement that with anything else afterwards, great. If you don't, it's all right.
Yeah, even smartwatches have like reminders on them that, hey, time to move.
But
time
it's
to get up.
But it's all based on science, right? They do that because they're those reminders are exactly the same things that I say as a physio. It's like you should get up and move.
Yeah.
Don't make it so complicated.
Yeah.
Like I always recommend to my patients, oh, I didn't walk on my Stairmaster for 45 minutes, or I didn't run on the treadmill for an hour, so I lost all my gains. It doesn't have to be that deep. I just need you to go out there and just walk. Walk for 45 minutes to an hour. Go to the mall or something and just stroll around. So at least you're like, okay, like I didn't do what I was supposed to do, but at least I still moved a bit, right? So that way it's not like you did nothing at all, right? Because that can lead to that negative mindset.
Right.
And then it just keeps going on and on.
Now, Walid, how does mental health plays a role in physical rehabilitation?
I think they play hand in hand, right? Like most of the things that I deal with is like fear over movement. Like when someone comes in, they're like, my foot hurts or my knee hurts. The question I asked them was like, why did you decide to, what was the moment that made you go, okay, I'm gonna pick up my phone and call a physio, right? Whenever I ask that question, they always think of a specific instance. It could be like, I was trying to pick up my daughter and my back killed, or I was going up the stairs and my knee just gave out, right? Like, I think mental health is one of those things where like it plays a bigger role than you think. There's a meaning behind a lot of the reasons why you show up to any doctor or any physio or anything like that, right? So once you sort of identify what the actual root problem is and you can understand the mindset that's going behind this injury, then you can start addressing that first in order for them to help overcome that injury. So they play hand in hand. Once you can identify that fear and you can help them coach them through that, then you encourage them to move and try to address that fear, right? Once they're like, oh, I can move, I can actually lift 10 pounds off the ground, so 20 pounds is how much my daughter weighs, right? So I'm not that far away. They get a little bit of inspiration there. So that movement then reinforces that this fear that I have, this mental barrier, is not that big of a deal. So I'm gonna push myself harder here. So let's keep pushing. Oh my God, I can lift 25 pounds off the floor now. That's amazing. What does that do for the mental health? Amazing, I feel so good now, right? Then they go, okay, I wanna do more now. That's how they both play hand in hand with each other, but you need to address the mental part of it in order for them to overcome the physical barriers.
Right. Now, how do you yourself stay motivated in your life, and how do you balance your work life with your physical activities? Because as you said, you're big on basketball.
Yeah.
So how do you balance it, and how would you suggest any youngster who's in high school or university to have that kind of balance and to maintain everything together?
When you say a youngster, how old are they?
Well, they're in their universities, they're just starting their career, they just got their first job.
Cool.
They used to go to the gym a lot, or they used to play a lot of sports.
And now it's all sport.
Yeah,
like
now
study.
studies or work, and they cannot manage. Like how do you manage so maybe they can manage as well?
My honest recommendation is to find where your passion lied, right? So like if you had a sport that you loved playing before, everyone has a sport that they played growing up. Mostly.
Well, it's funny because I stopped playing cricket for, I don't know,
I remember
10, 12 years, and then I started again. And I've been playing regularly now.
Exactly. So
Yeah.
I played cricket with you growing up.
Right.
So I remember how good you were back in the day. So like seeing you come off of it, I can see the difference in how much you moved.
Right.
Right? But as soon as you start playing a sport more, especially like yourself who was really passionate about it before,
Right.
you can see how much more you're moving now.
Right.
So my honest recommendation is as soon as you know, if you have a sport that you played before, right, and you're passionate about it, find that sport again, try to play it in your community. It allows you to kind of connect with people, get you out of the house and everything like that. Once or twice a week is not gonna kill you. I don't care how busy you are, right? Like you can find a way to make that work. If you don't have a sport or you didn't play any sports growing up, find a sport. Then the sky's the limit, right? My recommendation would be to like play pickleball. It's a very simple sport, very low energy, like very low buy-in. Doesn't have to be it's not super skilled or anything like that. Anyone can play that sport, right? It's fun. It just gets you outdoors and just gets you moving. Once you find that sport that you're playing, right? Once you identify that, then you can, if you get hooked onto it again, then you can address how to move better in that sport. For me, that's what worked the best. Right, like basketball was one of those things that I revolved all my training around it. Right, so I was like, I need to stay in shape. I need to get my cardio up. I need to get stronger. I need my legs to get strong. I need to get my upper body strong. That's how I centered my universe. That's one factor that was a huge thing for me. Other things are like just personal factors, right? Like I have kids, like they're really young right now. I just keep thinking like 20 years from now, 10 to 20 years from now, like I'm not gonna be as young as I am now. I'm gonna move a lot different, but whatever I do now is gonna be like an investment for my future. Because if I'm 40, 50, 60 years old and these kids are now starting to enter their prime for their sports, for me, I'm very passionate about being able to play with them. You know, like that's just my thing. We both have an uncle, for example. He plays cricket with us, right?
Yeah.
I find that like that's amazing. Not all uncles play.
Right.
He keeps up with us, and that to me is an inspiration because he probably did a lot of work, and we both know he did a lot of work in order to be in this position today. So I always think of my exercise and my motivation today. It's not motivation, it's just what am I doing today to invest into this today? It sucks, it's hard, it's not fun all the time. To make sure that I set myself up for the future, to make sure I can move for myself, be independent, and make sure that I'm not on walkers and all that stuff, but also make sure that I'm there for my kids and my nephews and my nieces. Right? So that's like find your sport, revolve your workout routine around it, and yeah, move more, man. That's what I would recommend.
Now, Waleed, the next question is, I think that's a misconception I have personally, that there's a limit or there's an age limit when people think that, hey, now I'm 40, I'm 50, and it's too late, and I cannot start to do this anymore. Like, is that true? Like, is it too late after a certain age that, hey, now the ship has sailed and you cannot do nothing about your physical health and it's not gonna benefit you anymore, or you just should calm down and just take it easy? Is that true?
No, I don't believe that, because it's like with anything. Like if you think of like even finances, right? It's never too late for anything for you to turn things around. Right? You have to take action at that moment. Now, are you gonna be doing the best things of your life physically past 50 compared to your 20-year-old self?
Right.
Unlikely, I would say. but there's a lot that you can still do at 50
Mhm.
that's gonna set you up for better stuff like a year later, 5 years later, 10 years later. These things are like almost like investments that you're putting in that's always gonna have a very positive return.
Right.
The only thing that you can't do is that you cannot do it recklessly.
Yeah.
Like you just need someone that you can trust a little bit in your corner
Mhm.
that says that, hey, like you're doing too much this week, you gotta take it easy the next week, right? You just need some guy. Like it could be a physiotherapist, but it's totally a myth. And this could definitely go into the misconception that you were saying, like it's not the end. Like I always say to my dad and my mom too today, like I'm like, you guys are entering your 50s, 60s, 70s, like you're gonna be going into these ages soon.
Mhm.
You guys should be working out more than me.
Now, Walid, I remember you telling this to me once that, Ahad, after 40, and I'm pretty sure a lot of my viewers would want to know this, that after 40, muscle mass starts depleting, and that's when you should have higher protein. You
Mm.
have that kind of support to the bones and the joints. Is that something?
I don't think so. I think muscles are one of those things where it could actually you can actually maintain a decent amount of muscle mass as you get older. The things that you sort of lose as you get older is more so your ability to have speed.
Yeah.
Your power decreases a little bit, and your strength decreases quite a bit. But if you're just purely talking about putting on muscle, you can do that. You'll see. You can actually search up like people that are working out in their 70s and 80s, and they look super ripped and jacked. It seems like it. Oh, that's not possible.
Yeah.
It definitely is possible because the ability to pack on muscle does not decrease. It does decrease, but it doesn't decrease as fast as your ability to sprint. Like you will always almost like out sprint a person that's like 70, 80 years old. But if you're talking about muscle mass, they can have more muscle mass than you. That's what I believe that.
Right.
But yeah.
Now, what's the most common type of pain, like that you find in patients who are closer to our age or younger than us? One that I personally feel like I've heard a lot of people complaining about is lower back pain.
Yeah.
I'm one of the person who actually came to you saying that, hey, Waleed, you gotta help me out.
Yeah.
Is that the most common type of pain you are being referred for? Or is there any
low back affects a lot of people. Like low back affects, I think I was reading a stat, it's like 70 to 80% of the population at least once in their life. That's a lot of people that are affected by low back pain. What else do I typically see that's most common? It's tough. Neck pain comes up a lot.
Right.
Neck pain and low back pain does come up quite a bit. Knees do too, but like honestly at that point it's like everything comes up. But low back and neck.
So there are a lot of products out there for neck, like neck pillows and comfy neck pillows to sleep better. And I don't know, there are some kind of equipment out there to stretch back properly and when you're sitting, because I told you that I drive a lot, so I have a back problem, and you told me that how you have to have your posture correct and whatnot, and there are some supporting equipment out there that you can buy. Is that something you recommend, or you think that no, I think the better way is to go through exercises and that's what you build the muscle and eventually the pain is going to go away rather than using an equipment?
Yeah, so I hope I can communicate this well, but essentially when you're thinking about buying equipment, think of it as a supplement. A supplement is not something that's going to fix you. Okay? Like a supplement is just a supplement. It is there to provide more value to what you're already doing. Now, if you're a person that's like saying, I sit for 3 to 6 hours a day in the car and I'm driving, your problem is not the lack of equipment. Your problem is that it's the lack of movement, right? Always remember, the more movement options that you have throughout the day that you explore, the less likely you are to feel pain. If you are stuck in one position for a while, whether that's sitting, standing, running even, and you're just doing that one thing all throughout the day, you're more likely to experience pain. Should you buy equipment and stuff of that nature? Again, don't do it blindly. Always remember that it could work, but we don't know for sure if it will. I don't start there for sure. Like it depends on the injury. Like if someone's like, oh, I fractured my ankle or something, then yeah, you need equipment. You need a cast or like a boot or something to make sure you support yourself, because that's actually what you're supposed to do.
Right.
But just don't buy things to correct your posture or anything of that nature just because you're in this serious amount of pain to see if that equipment can help you, because your problem is not going to be fixed by one supplement.
Right. Now, Walid, again, I don't want to create a misconception that a physio has to be a physique geek too, right? Like you know yourself, you work out a lot. I've seen you working out. Is there any connection? Like, is that something motivated you to become a physiotherapist, or vice versa? Like, you're a physio, that's why you like to work out, or you want to be physical because now you know what problems you can get into if you don't work out.
Yeah.
Or like, is that relatable?
It's definitely relatable. Like, it goes back to what you asked me in terms of why I pursued this career, right? Like, for me, it's like I was always a person who liked to play sports. I was very competitive growing up. I had 2 older brothers who did not include me in anything, and the only way that they included me in anything was me being able to keep up with them in sports. They would be like, "Oh yeah, let's play some cricket. Let's throw like a simple like little toss at him so he can hit the ball."
We've all been there, yes.
Yeah, 2 or 3 balls later, they're like, "Go downstairs now," right? So it's like for you, then for me, it was always like I was very competitive in order to raise my level to make sure I can catch up to my brothers who were 4 years older than me, right?
Yeah.
That was always a battle until like we got to like 16 to 18 years old when you get stronger, right? But that competitiveness like sort of carried into me wanting to always get stronger all the time.
Right.
Now, I love that part of it. It's hard, but that always like kept like that was a huge part of my life. So if there was a way for me to stay connected to that, and also studying it, like, because studying is like, it's important to me, right? Like it was.
Yeah.
If there was a way for me to connect the two together, that would be the best thing that I can have. And
I don't think you had an option for not studying.
I never did. Sorry, Mom.
Now, Walid, can you share a success story for somebody who went through an injury, and how did physio help them bounce back? Like any athlete, any person who was very sports heavy and he got into an injury and you guys actually made him like, could you tell us that success story or the journey of how it happened?
Yeah, it's there's countless examples, like, because you see so many clients like throughout the week.
Right.
The one that kind of sticks out to my mind was like a gentleman that was maybe like around our age. He played hockey. He was kind of like in the same boat as us, like oh no, like I used to play competitive hockey, and now for like 2 years I stopped playing for a bit, and now I'm getting back into it now. Started playing a bit more, and he had like a freak accident where basically, like in hockey you have like the hockey sticks, and then someone swung the hockey stick and actually hit his knee. And when he got hit in the knee, there's a patellar tendon that sits there, right? It's like a little tendon that kind of comes from your quad muscle, right? Your thigh muscle, we'll say. It hit the tendon so hard that tendon actually snapped in half.
Right.
That rarely happens. Very, very weird incident. There was like a 6 millimeter separation there. So he went to go see an orthopedic surgeon, and the orthopedic surgeon said, go and see a physio for 4 weeks. Without surgery, without surgical intervention. He just had like a tear in his patellar tendon that basically prevented him from like really engaging his knee. So every time he would step up and down the stairs, it would feel like his knee would give out. So after actually we rehabbed for about 3 to 6 months, we were pretty aggressive for a while. He was able to play baseball. I think it was in the following summer. He got injured in like September, October, somewhere there. So the winter months are okay. Like he's like, I'm not gonna play sports again. It's not gonna happen. But once he started seeing that he was able to squat and had no pain, going up and down the stairs and had no pain. He had a very physically demanding job too. I think he was like a carpenter or something. He was able to go up and down the ladders and not worry about his knee. Once summer rolled around, he's like, okay, I'm gonna try playing a game of softball, where he has to twist his knee and sprint a little bit. He played a game of softball, and he was like, I feel great. Feels like there's no issues. So, yeah, that was one of the success stories that comes to my mind.
Interesting. Now, Walid, what do you think is the future of physiotherapists or physiotherapy itself? Because I know it has been evolving. People now in this age have more knowledge about physical health and mental health than they had before.
Yes.
Like when we were growing up, there was no concept of starting gym when you're young or getting into the habit of exercising. Now it's becoming more common.
Yes.
So what do you think is the future of physiotherapists, and how, if anybody would want to pursue a career in physiotherapy, what steps they can take in Canada? Like when I ask you this question is, what are the educational options they have, right? What path they can take, and what are the career options they have, right? Like you work as a physiotherapist. I know there are physiotherapists on sports teams as well.
Yeah.
So like if you could describe that.
Sure. Yeah. Like let's talk about the first part of that question, right? The future.
Yeah.
Man, the future is weird, right? Like the future, I was reading somewhere, it says something like there's gonna be like 60 to 70% of jobs are gonna be created that don't even exist today.
Right.
So this landscape is evolving, and it's evolving really fast. And both of us know that's probably because of the AI technology that's out there. ChatGPT is changing the game completely, so things are only becoming more and more efficient. Some of the fear that I guess physiotherapists, like myself even, have is the fact that, like, what if ChatGPT replaces us, right? Like, I'm off that train now. I don't think it's gonna replace us at all.
Yeah.
But I do think it's gonna be a huge supplement to how we provide quality care.
Well, yeah, I'm of the same opinion too. I don't think human element can be taken away.
I don't think so.
Yeah.
It just, I don't think it's gonna happen. But will it make things more efficient? Yes. Like there was a paper that I was reading from, I think it was the like a physiotherapy association in Australia.
Right.
They were talking about in how potentially in 2040 and 2050, like around that time, patients are gonna have access to their own images. And they can do X-rays, MRIs, and ultrasounds in real time, like this.
Right.
That changes the game completely, right? Because if a patient comes in, they're like, my knee hurts and this, that, and the other, and then we're just like, okay, but we should probably image it to see if there's a diagnosis or what's the prognosis look like. Is there a tissue that's torn in there?
Right.
If AI allows you or technology allows you to sort of get the image done right away, it changes so many like steps that we have to take before. It would be like, okay, Ahad, you need to go get an X-ray done at the emergency care. Like you fractured your finger, I was like, you should go get it checked right away.
Yeah.
But it required you to go to a doctor and then go to urgent care, get the image from him, and then once you get the image results, then you come back and tell me about the results.
Yeah.
But if you just come to me and like, my finger hurts, I'm like, let's do an image. We just do it right there, everything changes, we establish the plan like right away.
Right.
So I think the quality of care in the physiotherapy space is only going to become better, which is super exciting for me.
Right.
Now, as it pertains to your other question, I think you mentioned how do you become a physiotherapist in Canada?
Yeah. And what are the career opportunities?
Okay. So my studies, what I did here is I was in UFT for undergrad. I did life sciences. You can do anything. You just have a certain amount of prerequisites that you need to take.
Right.
Prerequisites means you need to take these courses essentially in order to apply for a master's program in physiotherapy.
Right.
Okay, so it needs to be like anatomy. I think you need to take some physics in there. I can't remember all the curriculum from the top of my head, but just go on any UFT, like not UFT, but any website that offers a physiotherapy master's program, and they list out the prerequisites. Get into any program that you want in university in Canada, and make sure you complete those prerequisites.
Right.
Once you complete them, it gives you an opportunity to apply for the master's program.
Right.
Now, if you do it as an international student, you can do like an undergrad or like a bachelor's in physiotherapy in some countries, I feel.
Right.
Once you do that, then you're going to be potentially in an international bridging program that's also offered here. Don't know exactly how the application works for that,
Right.
but you wouldn't need to go into a university, do the prerequisites again and all that stuff if you already have a background in bachelor's of physiotherapy from somewhere else.
Right.
Other things that I should probably say though for application, it's very competitive. They look at your GPA, and the cutoff for Canadians was like 3.83 or something like that, which is on a 4-point scale that's like above like an 85-90% across your last 20 credits, last 2 years of your undergrad study. And it's even still, it's very competitive. Like you're thinking like 1,500 to 2,000 students are applying to this program, and only like 60 to 100 students get it. So it's not easy, right? But if you get your grades up, you have the experiences, you're very well versed in this space, you can get it. You have a shot, right? Just like me. I got it,
Mhm.
right? I made it. So I'm sure you guys can make it too. In terms of career options, now I should be clear. I'm a physiotherapist, but I work in a private clinic. So that means that you come in and you're like, well, something hurts. Can you be my physiotherapist? Can you take care of these needs? I need to do this, this, and this. You're gonna have an insurance that you have from your work or whatever. You're gonna use that insurance to kind of get your stuff done here.
Mhm.
Now that does not mean that physiotherapy only applies to those people that kind of voluntarily go into private clinic,
Mhm.
right? So when you go into hospital care, right, cardiac unit for example is a good example. If someone has a heart attack, a stent put in, something that kind of has an incision across the chest to kind of open it up, there's rehab that needs to be done for that.
Mhm.
And for those patients, there's physiotherapists that work in hospital settings that are gonna visit them. It's not like the person that had the stent put in or this cardiac surgery done, he's gonna get up and find a private clinic and do his rehab there.
Well, it's interesting because I was at a hospital and somebody had have them their appendix was removed and they were going through a rehab of like if they could walk properly and they had no pain from the stitches and whatnot too.
Exactly. So
Right.
there in rehab, the goal of physio is always to establish what the person's previous life was like, what are their goals, what has this recent incident caused,
Mhm.
and how far away are they from their baseline,
Mhm.
and what can we do to make sure that they're safe and healthy enough to kind of go back home
Mhm.
and work towards that. So in a cardiac setting, for example, they would see the physiotherapist for maybe a few days,
Mhm.
like 3 to 5 days maybe, and then they would just make sure that they can walk, they're not getting any issues with that. Can they stand up on their own without like losing balance or anything? Can they go up and down the stairs, right? Can they do that safely? Cool, okay, you're good. Discharge, go home, but you're gonna now follow up with another rehab in an outpatient clinic for 2 weeks, like stroke rehab or something like that. All these areas are where physios work. You can work like directly in a hospital setting. You can work in the next step where like there's cardiac patients in stroke and cardiac rehab for about 2 to 3 weeks, right? That's an outpatient clinic. Or you can work as a physiotherapist in your own practice. I can just go on my phone right now and create a business as a physio and be like, I only cater to basketball players and I only want to be a physiotherapist for basketball players. Anyone that's interested in basketball, plays basketball or anything, come to me, I'm your guy. Message me, I'll hook it up. Like there's a lot of autonomy with this.
Right.
That's more like the businessy side of it. The hospital settings, cardiac unit, neurosurgery unit, appendix, knee replacements, hip replacements, all these things that happen in a hospital setting also require it, and that's more like a safe public sector sort of salary-based job.
Right.
That makes sense. Yeah.
Makes sense. Makes sense. That's actually a very vast career opportunities out there.
Yeah, exactly.
Yeah. Now, Walid, couple of last questions. I have two more questions, and then we can wrap this up.
Sure.
Because I've taken a lot of your time.
No, that's fine.
One question is that how our parents are like from where we belong from. They were not that physical active or we come from backgrounds where people do not focus on physical activities when they're young or like that, and now they have gotten to a point where they're in their 50s or 55. What practices they can
do?
do to eliminate some of the pains that start with that kind of age, or what movements would help them to actually prolong, say the old age factor?
Oh yeah, 100%. I think the biggest issue with 50, 60-year-olds is the fluctuation in hormones, right? So males experience a nosedive in testosterone. Females experience like all sorts of stuff with their hormones in menopause. So that ultimately leads to more, eventually, not just that, but like for females, they actually also experience like osteoporosis and things of that nature,
Right.
which makes your bones a little less dense,
Yeah.
which makes you more prone to fractures.
Right.
Biggest things to do as a 50, 60-year-old is to just make sure that you move in some capacity. Make a daily practice of walking every day. I keep coming back to this. It is so simple. It gets you outside. It gets you to move all your joints. That's number one. Number two, things that they can do, like it's hard to like just use one particular exercise or anything to kind of.
Is there like a beginner they can follow to start some exercises on?
They honestly should see someone first.
Okay.
But the goal would be to try to work just as hard as as a 20-30 year old.
Right.
Like you need to work hard.
Right.
But again, consistent practice is key, right? Like I don't know, like you can even do like a little like I had a lady who's in her 50s right now, and she works out in the morning for like 5 to 6 minutes and just does gentle stretches. She comes in the clinic, she's like, this is what I do already, I should be fine, right? This is good enough. I'm like, no, like you need to like work out like a proper workout routine. So I made her an entire upper and lower body day. Like it's like you do your lower body for like 2 or 3 times a week, and it includes things like squats, doing like calf raises, doing like lunges, like upper body would be like chest presses, push-ups, everything. But
is doing yoga good? Like
it's
more
amazing.
than enough?
No, it's not more than enough.
Okay.
Nothing. So the way that I would do it is like this. Like you would need to have some component of cardio. So let's say walking. You walk 3 to 4 times a week, 30 minutes at a time.
Right.
That I think should be a practice for everyone. If they can walk every day, amazing. Like that's even better. That's the cardio aspect.
Right.
Then there needs to be some element of working out. Now the bare minimum, I would say, do 2 days a week. Just 2 days a week where you do upper body day and lower body day. If you want to do the bare minimum. Some people can do push-pull, right? So an upper body day could be something as simple as doing some form of chest press, like on a machine if you want. Shoulder press with very light weight, like 2 to 5 pounds if you want. What else can we do? We can do like a row, right? Like just bending over and doing a row with 5 pounds even. For the lower body, just squats, do a little bit of calf raises, and some element of a hinge, like a little bit of like we call it a deadlift, but very lightweight, very gentle. That's it. Like 2 days of working out, along with 3 to 5 times a week of walking, is a great place to start.
Right.
And also, you guys are probably close to retirement, so you have all the time in the world.
Right.
You guys shouldn't be on your phones, on Facebook, and everything like that. Get off of that. Get off of that, mom. And get out there and get on a bike.
I'm
even.
pretty sure you have to go home too.
I do. But like get off your phones and move a little bit, just a little bit. If there's any pain with anything, it gives you an opportunity to go see like an expert, right? And then fix that, and because as soon as you start moving more, you get more and more, like you get more goal oriented. You get more. Like the balance is a huge thing. Like for 60 and 70-year-olds, that's the biggest risk for mortality, right? So mortality, that's like what's the biggest risk for someone to pass away? It's the fact that they can go outside in a winter day and they can slip and fall on their hip, fracture their hip, and be on bed rest for 10 days.
Right.
They lose 2.5 kilograms of muscle mass in 10 days if they're just on bed rest.
Yeah.
They come out of that when you're 70 years old and you lose 2.5 kilograms of muscle mass with all the practices of eating gulab jamun and all this stuff at home, right? You're not gonna be able to gain that same muscle back because it's so much work to get it back, right? So if you can work on your balance somehow, do 2 days of just doing upper body and lower body and just walk every day, you're gonna be headed in the right direction. And if you have more questions, you can reach out to some physio. You can reach out to me, right? We'll figure it out. We'll figure it out.
Right. Now, one last question, Malik, before
Yeah.
I let you go, is what does success mean to you? Because, like, you know, in this generation and younger than us, you know, I think we have gotten into a habit of just running after money or materialistic things that, you know, I want to drive a fancy car, I want to have a big house, and that's what we have positioned success. Like we have directed that if we have a big house or a car, we are successful.
Yes.
Like is that success for you?
No. I mean, it'd be nice to drive a Ferrari one day.
Yeah.
Maybe. But I don't. I think I've thought about success for a while. I believe success is one of those things where you are almost working so hard towards something that there's moments where you actually fail in it. There's moments, and only you know how much those failures hurt. And then you still manage a way to kind of work through that, like failure, and you kind of work through that process until you're kind of reaching for this, like, I don't know, some reward, some accomplishment, some degree. That journey is what is success for me,
Right.
right? Because as soon as you achieve that thing, if you work hard enough for it, it almost feels like not only a win for yourself, it feels like a win for your loved ones, right? So the moment that like you see your family get like elated and they're so happy for you too, like that is true success for me, right? Because the amount of work that goes into it, that your family's involved in it too, and as soon as you win, it's a win for everyone.
Yeah.
I think that's like the most beautiful thing that you can have if you get to experience that.
Right.
Because the same thing, when you fail in it, like your family and your sisters, your brothers, your mother and your wife and your kids are gonna be just as disappointed as you. So it's like once the success part would be like the happiness that you get when you achieve that thing. It also leads to something else. Because if you just drive a Ferrari for yourself, yeah, like your mom would be like, cool, that's nice, but it's just a token for you, unless that token represents something else, right?
Right.
Like, but for me, success is just that.
Right. Now, last advice to my viewers that you could give, Walid, for anybody who is starting gym or who has been going through to gym for a long time, they're physically active or they're not physically active. What would your advice to my viewers be? What can they do? Whatever advice you can give to them, the camera is all yours.
Okay. Not so much advice. I would say I have a challenge for all your viewers.
Right.
Whoever's watching. I would urge you to go on YouTube and type in the Sally Up Challenge for the lower body and maybe even the upper body. There's a squat version and a push-up version. Just type that in and try to follow along and tell me what you guys think.
Perfect.
Sally Up Challenge. Try it out.
Thank you very much, Walid, for joining us today, and I really appreciate it. I'm sorry I took
No, stop saying. No, it was fun. It was really good. It was really good.
Thank you very much. It was very informative. Thank you.
Thank you for having me.
So, viewers, thank you very much for joining us today, and I hope it was informative for you, and it actually motivated you guys to be actually physically active. And at the end, we got to know about a challenge. I hope you guys try this challenge out and see what your physical health is like, and do comment and let us know. Until next time, thank you.